Good morning, everyone. I am Sylvia Trujillo, the Executive Director of the California Telehealth Research Center. We would like to welcome you to the 13th Annual Digital Health Summit. Before we get started, I'm going to hand the initial slides and introduction and overview to Lydia Katowski.
Thanks, Sylvia. I want to echo Sylvia's welcome and thank everyone for joining us today for our exciting keynote session presented by Christopher Curry from the American Medical Association. As you know, the theme of this year's event is Technology Supercycle Meets Healthcare, Leveraging Digital Health Services to Combat the Chronic Disease Crisis and Other Challenges. As we get started, I'd like to go over a few tips to help you navigate the conference platform. This session is purely for informational purposes. CTRC has no relevant financial interest or arrangement with any organizations related to commercial products or services discussed during the summit. Next slide, please. Just to note that you do have to register to join each session, so if you haven't done so already, we're going to drop a link in the chat and we hope to see you at our other sessions later in the day. You can use the Zoom functions to ask questions, post comments, and connect with fellow attendees. Use the chat feature to interact during sessions. This session is being recorded and will be posted to the CTRC website or YouTube channel by the end of the month. If you encounter any technical issues, reach out to a member of the CTRC team on the platform or contact us at caltrc@ochin.org. Next slide, please. We'd also like to thank our funders, the U.S. Department of Health and Human Services, and the California State Office of Rural Health for supporting the program and this digital conference. We would also like to acknowledge the contributions of our co-sponsors, the California State Rural Health Association and the Insure the Uninsured Project. And with that, I'm going to hand it back to Sylvia, who is going to be our moderator for today's keynote.
Great. I could not be more delighted to have our guest today. I just want to flag that we're going to hold the last portion of this session for questions. We welcome you to drop questions in both the chat or the Q&A. Chris will provide an initial overview, and I encourage you all to be part of the conversation. So, tremendous pleasure. Chris Corey is the Vice President of Strategic Insights at the American Medical Association. Chris leads the organization's work on identifying transformational forces in healthcare. He is a ninja at combining data, research, and foresight to shape a future where innovation meets impact. Chris was one of the first people I had ever worked with who really was magical in pulling together these various elements and to help inform the work of the American Medical Association. And so it's really no surprise that he's at the forefront of exploring how technology, policy, and market trends intersect to influence physician practice and patient care and really the trajectory of healthcare. Under his leadership, the AMA has produced some of the most forward-looking analyses and forecasting in healthcare, helping providers and policymakers alike navigate disruption from AI. Sometimes it feels like AA, from AI and digital health to the future of medical education and chronic disease management. We're honored to have you here, Chris, and I'm going to go ahead and hand it over to you.
Wonderful. Thank you, Sylvia. Good morning, everyone in California. I'm here based in Washington, D.C., so it's around lunchtime now. I'm really excited to be here with you all, and I really appreciate the invitation from the whole team at CTRC. As Sylvia said, I've been fortunate to be kind of what I'd call policy adjacent for much of my career in Washington, D.C. And for part of that career, that involved being adjacent to Sylvia, who is exactly the person you want to be next to really understand how policy intersects with all of these forces we're going to talk about. You can see the title on here. This is an ambitious title, and I'm going to do my best to touch on the themes that are included in this title. But I want to first, give special recognition just to an organization like CTRC and the organizations that you all represent that participate in the CTRC. And I just really want to emphasize how important it is nowadays to have common resources technical assistance you can draw upon, and a sense of a shared journey, right, that you're all going on here. And that's an inspiration. I think this type of model is an inspiration for the rest of us. And there will be a lot to learn undoubtedly from the journeys you are all going on. So without a doubt, I'm going to touch on AI. It's really hard to avoid nowadays not talking about it, partly because it's one of the few technologies that's poised to have such a big impact on virtually every aspect of the healthcare journey, from the delivery and the diagnostics to the administrative pieces to the patient engagement aspect, all the way to medical education, how we train physicians in the future. Um, the impact's going to be big, but we've got to get this right at a local level, and at a societal level. And I don't want us to leave this conversation today naive to that. From what I can see on the agenda, it's going to be an incredible agenda today, and I really encourage you to listen to the wonderful other panelists and speakers that are going to be speaking today at this event. Um, and I think you'll come away, I hope, energized and equipped. So go ahead, if you could, whoever's moving the slides. No disclosures to disclose there. Scarcity. So scarcity is a theme, and probably one of the biggest and most acute scarcities today is certainty. The world we live in, that is filled with uncertainties. And in fact, the, a presentation like this is really hard because all it took was, something as significant today as the passing in the House of the budget bill, that will have a seismic impact. And so, those are as well prepared as you can be to talk about these things. New things come up, and we face a lot of uncertainty in all the work we do. But certainly questions around the future of federal and state assistance programs, um, labor supply of workers and staff that can be in the environments you all work in, FQHCs, rural healthcare settings, and so on. Um, and here we have, a confluence of all these things that feed into the scarcity dynamic. So the unsustainable economics, the political and regulatory disruptions that we're facing, a mismatch of supply and demand around what patients actually need, the type of care they need, and who can provide it. Questions around evolving care and delivery models, and this sort of overarching thing that has plagued our healthcare delivery settings for so long, these administrative burdens, all that feeding into this pressure cooker type environment. Um, we're talking a little bit about chronic disease today, and you all know this acutely, intuitively and firsthand, which is that the prevalence of chronic conditions continues to get worse across all of the categories. And there are ranges and estimates, and they're all, not pointing in a positive direction here. So that's one dimension. Go ahead, the next slide. And of course, this chronic disease not only hitting the baby boomers as they're reaching those late stages of life, but the ballooning out of the millennial generations also, not only in terms of population, but the types of chronic diseases they're facing too. So this isn't just an aging and chronic disease issue; it's really affecting all generations. Hospital operating margins. Um, when you look at the histogram for hospital operating margins, a lot of them are negative. A few of them do quite well, and most are sort of in this very thin zone of survival here. But they have improved since those earlier days. And as I said, they've improved, but these long-term business models are still under threat. A lot of pressures, economic and industry pressures around consolidation, around whether those nonprofit the status can be maintained under new regulations. Drug manufacturers' machinations around 340B discounts and other dimensions. Go ahead. And I want to pay all due respect. Go back one slide if you don't mind. what you all encountered, especially in Southern California during those the wildfires that you all experienced there. And here's a stretcher amidst a inferno here. Um, the it Not only did you have uh, that shock event of a wildfire, but when you think about the spillover effects that hit the communities, certainly chronic disease, premature term births, um, mental health issues, it really continues to hit even well after the actual event. And so again, this scarcity environment it hits in many different ways. Go ahead. So we'll get into a little bit of the heart of this technology discussion here. And I picked these pictures because if you go to a presentation on AI, you usually see a human brain with some circuits attached to it, that sort of thing. But the reality is AI kind of looks like this. This is the suburbs of Virginia, not far from me. There's a big faceless sort of windowless building that's filled with servers, right? And this is the backbone in the infrastructure that is feeding the AI environment. It's still connected with wires. It uses a lot of water and energy resources. And This is what is fueling this major economic push right now, are buildings dotted all across the landscape like this. Go ahead, please. And some of this might be, again, intimately familiar to the folks on the call now, and some of it not. Um, but we've actually been on a 50 to 60, well, 60 to 70 year journey around AI, and at least a 30 to 40-year journey, depending on how you look at it, within healthcare applications. There are many different flavors of AI that you can see today. The era that we're in arguably has evolved past this machine learning era and deep learning era into natural language processing, into generative AI, multimodal AI that involves not just text, but images and other media dimensions. And these are all kind of converging alongside things like computer vision, right? Think about in some healthcare facilities, hand washing stations that verify you've washed your hands for long enough. That's computer vision, robotic drug delivery, and so on. So different flavors, but we're in this generative AI era. And I would like to think, without being over hyping of this, that it is a little bit different this time than in the past 70 years. Why is that? Well, so much of the AI we use today is actually accessible to all of us. It's not behind a computer science department anymore. It's in everyday consumer use. And so, not surprisingly, this creates a sort of a pressure on the healthcare system to kind of catch up with the rest of the economic environment we're in, which is actually quite infiltrated by generative AI. So increased public awareness, but also just the general accessibility. The economics are making more sense now with accessing computing power and so on. So a lot of things have changed to make this more real. Go ahead, please. Um, and y'all are in California, right? So you are at the epicenter of the funding environment right now, especially Silicon Valley, but it spreads to a lot of different places. This is still a very actively funded environment. Increasingly, early stage companies are not just getting a few million to get going, but you know, tens of millions or more if they're onto a big idea in healthcare in particular. And so it is very frothy with a lot of money. And I want to emphasize this that uh, in the era of AI, we have a different layers of value. We, meaning the providers in the organizations you represent here. Um, there's an incredible amount of data that you are generating, and not surprisingly, a lot of these companies are greatly interested in the data you produce because most machines need a fuel, and the fuel that you have is the patient data and the healthcare data. And so th this is going to be an important dimension. And we've all been sitting on data for a long time. Unless you have a really robust team, it's going to be um, hard to take advantage of that on your own. And so these companies that are out there and leading the way are looking to expand the type of data that's being captured, and sort of go through these stages ultimately to automate aspects of a healthcare delivery. Go ahead, please. And not endorsing any one of these, but the biggest companies out there, from Amazon, Microsoft, Oracle, Google, you name it, all have significant products, sometimes in partnership with others. Uh, Certainly, ambient scribing is a really big area right now where a lot of companies have felt like this is a sweet spot between administrative and burden reduction and for providers, and things providers are willing to pay for. But a lot of different aspects. And here's kind of a frontier slide. You have to take a second to stare at a little bit, but think about the dimensions of low risk applications of AI to high risk applications, and things that are focused on productivity enhancements, versus things that can really move the needle on value-based care. And there's a frontier, and this is an estimate about what the frontier we might be at. Automating insurance prior authorization, certainly patient note generation from conversations, more effective patient engagement material around diseases. But in the future, you're going to see a lot more ambitious applications there. Go ahead, next slide, please. And a lot of work being done. These are just two case examples in health systems. Ochsner Health, for example, deploying ambient scribes. They've reached a really a high adoption rate among providers there to use technologies like this. It's something that's really benefiting both providers and patients. So a lot of experiments right now being deployed in health systems. Let's go to the next slide. Yeah, and we measure this. So AMA for a couple years now has operated a survey among physicians, and the big headline here is that the usage of AI tools has nearly doubled compared to the first time we measured it in 2023. And it's worth taking a note of the categories on the right-hand side. What are they doing with it, and what are they excited about? And the gray is the most recent data on the right-hand side. So draft responses to patient portal messages. I think you'll hear a little bit more about that in the agenda today. Translation services, insurance pre-authorization. These are all wins from enthusiastically received by a third to half of physicians out there. Yeah, and there are so many use cases out there. There is an adoption curve, and you all are kind of at the front or the end of that funnel, right? So you have the developers, you have the frothy investors pouring money in, you have the big infrastructure companies that are doing the cloud infrastructure, the dominant EHR vendors that see this as a sustainability path for their platforms. And you, as leaders in your organizations, the physicians in your organizations, are the ones kind of at the end of this funnel. One of the challenges, one of the takeaways is, how do you interact and how do you influence and shape what happens above that funnel? And we'll think about that a little bit more today. And this, I apologize, the figure is a little bit hard to read here, but I put this here especially in a technology-enabled environment that's driven by engineers. And I speak as I trained as an electrical and computer engineer. And so I know this thought process very well. Most of the studies, this is a meta-analysis of AI's deployment in healthcare settings, uh, uh, publications from 2022 to 2024. What did they focus on? They primarily focused on things in the dark blue, which is Can an AI, generate an answer to a question? Can it accomplish a task, or enhance medical knowledge? As you go to the right of this table, though, you notice that there is relatively few publications that look at the bigger social science questions of fairness, of bias, of toxicity of these tools, and the practical deployment and implementation considerations that are sometimes the hardest thing about AI is making it work in your local environment. And so we still have a ways to go before we have a good evidence basis here beyond just demonstrating that it can work and in some impressive way. So go ahead to the next slide, please. So I couldn't just, come to this event and only talk about AI because there's another force out there that, especially in the chronic disease front, that's worth talking about. And biopharma strikes back is what I've titled this in my low budget editing on PowerPoint. But I'll talk a little bit about what I mean here. You can go to the next slide. And we're all quite aware of the era we're in right now. It's a different kind of technological force, and it's in the therapeutic space, right? It's GLP-1s and other, there are other incredible advances happening right now too. But we're at the point now where we're in that second era of GLP-1 inhibitors, where we are looking at other applications of it beyond weight management and so on, ranging from addiction to liver disease, Parkinson's disease, and so on. And you can go forward here. Prescriptions have soared, right? There's questions on how private payers and public payers will pay or reimburse for this. But without a doubt, this has been a wild success for the pharma industry. Um, and you can see, the cost pressures that it's adding to the overall medical cost environment here. And this was just actually a week or two ago, or a couple weeks ago, this got published in JAMA, right? Is that, of course, because of the health system we have and what you all see on the front lines, there are disparities patterns, even with as amazing as the science is behind these drugs. And you can see, and I think there might be animation here if you just hit forward on the slide. There we go. Yeah, I mean, disparities across a number of dimensions, from social vulnerability aspects to race and ethnicity, to urbanicity, rural versus people in metropolitan areas. It's all there for us to see that you can't simply just have a great technology and expect that disparities will close up, whether it's AI or a pharmaceutical intervention like this. Go ahead to the next slide. And again, this is very recent here too. Some of you may have saw this headline that we have other very costly technologies, but incredible science behind them around gene editing too. So I think when you take a step back, there's a number of technological forces here that are just going to fundamentally change the way we practice medicine alongside AI. So I want to, sort of begin to conclude here. And first of all, also just encourage folks to think about questions for Sylvia and myself. If you have them, feel free to post them in the chat or the Q&A button. Um, I think this is kind of where we're at. I want to ask you all and think hard about what color you are at here. And if it would be understandable if you were in the orange color right now, because you all are facing an incredible amount of pressure in your day-to-day operational environment. And I want to sort of get us to a point where we can rise above that, right? And that we have agency ultimately as providers that are addressing the neediest populations, the most vulnerable populations. We have power and we have agency, right? And so as you navigate your way around this world of AI technologies, undoubtedly if you've not already had this happen to you yet, you will have vendors calling you, you will have folks trying to demo these technologies to you. So you may be in the blue area, the light blue area. You're exploring your options now. You're learning. Or you might be further down the line if you're attending a digital health summit like what CTRC is organized here, you may actually be further along. But each one of these colors have certain buckets and questions that are important to address along the way. There are a number of good resources. I want to leave you all with some hope. I think the next slide has a number of resources here that we can share the materials. These are all links. Definitely encourage you to go to the resources page that CTRC has already pulled together. Um, uh, for other dimensions, remote monitoring, telehealth implementation, I'm sure many of you are down that implementation curve, but AMA has a number of great resources there, including how to code and get paid for different digital medicine scenarios. And finally, I'll mention, yeah, if you go to the previous slide, sorry, just to call out a group called Health AI Partnership, which I know works with some organizations in California, and who have done a lot of thinking around what health equity means and the types of decisions you do want to ask in each of those colored buckets that I showed on the previous slide here for implementing AI products. So you can go to the next slide, and I'll just conclude in these last two slides. CTRC and Sylvia gave me the challenge of defying gravity. And so as a kind of a scientific person, I looked into that, and it turns out you can only defy gravity for so long. Folks have done a study on the impact of being out in space and what that does to your immune system, both in humans and mice models. And there's quite a lot of damage that happens to your immune system. So I hope we can all defy gravity together for as long as possible, but please take care of yourselves. And I look forward to the discussion for the rest of the day in the Q&A. So thank you very much.
Chris, really want to thank you for that intro to the day and to the topics that we're going to be addressing. And so now's an opportunity for our audience to add questions into the chat. Um, I'm going to, of course, throw some questions at you, but we're going to go ahead and take one um, right off the top. We have a participant who states, my organization is between the two green squares and we're navigating two areas, two areas, governance and workforce upskilling. What should we consider in terms of training development? Vendors don't offer too much other than basic how-to instruction after implementation.
Yeah, thank you, Maria. That's a great question. Why don't you, if you want to tab back to those four color slides, Sylvia, just so folks can reference it. Um, yeah, the two green squares. So I've started now, what's next, or I'm implemented and I'm trying to grow or I'm trying to scale this. Um, Training and development is super important. Um, the there's quite a lot of resources out there that give you the kind of 101 basics, the definitional and descriptive language about what AI is. I do want to encourage folks, we've got to figure out how to go past that, I think. And the 201 level is around, um, 201 and kind of graduate level ultimately is around the decision-making environment you all operated in a delivery system, right? So you're now augmenting that clinical decision-making and day-to-day decision-making environment of all your staff, from nurses to physicians to all other frontline staff, with technological tools that were developed in a different place in some cases, and developed based on different patient populations, maybe trained on a different patient population. So there's a lot to unpack there, and certainly training and development, I think, needs to be on what are the questions you might ask of those vendors beyond just the how to, because the vendors will come in and they're going to train you on how to use the system, but before you get there, I think you really want to have a chance to understand how did they build the system? What patient populations did they train it on? What are they doing to make sure that the systems don't drift in a certain direction. What sort of other evidence basis do they have for the system? Of course, many of these, as you may know, are not necessarily FDA approved devices. The evidence basis for them can be varied sometimes, not necessarily clinical trials. So having I think the training and development on how to understand the technology, the evidence behind it is important for those that are really want to do this well. And then there's a governance aspect too, right? Because all of these systems involve use and access to your IT systems, to your patient data. You certainly want to know, and this has happened before, where systems sign contracts with vendors and the patient data is shared with another third party that's part of the overall product offering, and it's not clear, right? So those are all dimensions. I'll put a plug in there. We do have a number of AI CME credit um, learning opportunities on AMA's EdHub. If you Google AMA EdHub, there's a number of modules on there that are interactive in nature where you can also get CME credit on. And I'm sure there are other good resources out there too.
So, Chris, I'm going to take a step back and really focus on a point that you made early on in the presentation, and it's top of mind. We've just seen a lot of policymakers at the State House and in Congress making really significant decisions um, that will change the complexion of healthcare delivery in the country potentially. No final decisions yet on either level at the state or federal level. But it feels like there's these two things happening at once, this sort of rapid acceleration of technological innovation, a scarcity model around resources available to deliver care. Um, in addition to AI, we have, and you touched on this a little bit, I think, advances in bioengineering that are also unprecedented. And we also have the Internet of Things, so just the rapid proliferation of sensors. So, a national speaker has talked about this as the technology super cycle.
Mm.
So, on the one hand, lots of scarcity in our future, and on the other hand, technological super cycle. What does that mean for healthcare leaders? What is their call to action, and what do they need to be taking stock of? Whether they are leading a small healthcare clinic, if they're a Medi-Cal managed care plan in a region, if they're at a hospital, how do they think about balancing the need to invest in these innovations and the scarcity that they're looking at in the current environment?
Yeah, wow, there's a lot in there. And I think you got to the heart of how complicated the world is for a lot of us who are and you all who are leading and operating in these systems. And I'm sure the CTRC and OCHIN are tracking the issue, for example, of whether there would be a moratorium on state laws that can govern AI in whether that goes into the final bill, as I understand it. And we're also operating in an environment where, as some of the AI work that was halted in this new administration is just getting going again in places like the FDA. And so it would seem, and again, not my expertise, but that we don't have a fully robust policy environment that is sufficiently protective of patients and people and consumers. Um, and so understandably, the private sector will take advantage of this relative lack of structure. And it's a little bit of a land grab right now. I mean, we know this from the EHR trajectory of sort of where we've ended up with dominant EHR players now. And there's a clear dominant one, and there's kind of like a more distant second and third. And this is a little bit of an arms race or a land grab, whatever the appropriate analogy is, among AI, companies that want to dominate AI in healthcare. It's sort of the last sector that remains human labor dominated, right? And for good reason, right? For many years, for centuries, truthfully. Um, but we're also in an environment where the economics are not really clear yet. So you and I can all use Chat GPT freely, right, for the most part. But we don't, the economics are masqueraded from us. And I guess what I'd be worried about is an environment where in these early days, health systems adopt these technologies that appear to be lower cost than the uh, than what economics will actually play out, and find themselves in a more vulnerable position there too. And I don't have a good answer for that, but I think it's something to watch out for. Um,
So I'm
yeah,
gonna push you a little bit on
yeah,
that. I think there are opportunities. I mean, I think there's a lot to be um, vigilant about, right?
mhm,
So, but you and I, full disclosure, Chris and I worked together. I spent about 14 years at the American Medical Association, and we had the opportunity to work very closely on the organization's foundational efforts at policy development around AI. But even then, Chris, that was if incredibly, if you could believe it, that work started about just short of 10 years ago.
yeah,
And
right,
at the time, everyone said AI is like 30, 40 years from now. Let's not, there's no there there.
yeah,
But the conversation was ignited amongst physician leaders for several reasons. Workforce shortages as far as the eye could see that
yeah,
we could never remediate, rising chronic disease burden in the United States that had just an upward trajectory, aging populations that were contributing to that chronic disease cost and burden, and um, also the reality that the median age around the globe was increasing.
yeah,
So we couldn't grow our own clinical staff by, robbing and borrowing from other countries their brain drain of their clinical professionals. Um, and so it's clear that over a decade, we've had extreme system strain, that the investment of dollars was unsustainable in this sector. Is this a moment for us? Is this a moment for us to really rethink how healthcare is delivered? And how can we use technology to drive automation, efficiencies, and most importantly, sustainability in an environment where scarcity is like 10x? So
yeah.
are there opportunities for us? And this is likely going to be one of your last questions. So curious
Sure.
to get your thoughts on that.
Well, I think you phrased it nicely. Yes, we are absolutely at an inflection point, and a lot of the points Sylvia just brought up, um, the um, the confluence of all those things. These have been burning for a long time. We need um, to utilize technology effectively because it's going to get us, I think, to the next horizon. I don't think will be sustainable without appropriate use and deployment of these tools. I think our patient populations uh, are hard to reach. They're complex. So we are at a point where we need to get educated and smart on how to interact and incorporate these tools. And I think we're at a good point in the sense that even in the absence of a perfect regulatory and policy environment, we've got, I think, a really strong community, part of it in CTRC, that are going on this journey together, but across the nation, um, who are, you know, able to test and debug the technologies in ways such that we get to a better place. So I am hopeful. I mean, there is an incredible need, and there are so many use cases at this point. We don't have a problem of defining the use cases of AI's applications, both administrative and clinical, and patient oriented. They're all there, and uh, in some cases, these can be quite simple interventions. They need not to be a total, massive transformation on everything you do. So yeah, I am hopeful. Um, this is probably the most kind of concerted collective energy around change in healthcare that we've seen in a long time that really involves so many parts of our economy and industry and scientific knowledge. Um, so to the extent that that matters, I think we're in for an exciting and positive future.
Right, but I think you nailed it, Chris. I think we all have to be on the journey. We have to democratize the information and the knowledge. And all of us have a really key role to play. And, I work with a lot of organizations and do presentations and training. And the message is always, it's what you've echoed repeatedly throughout your address, and that is really, it's local. We individually need to be accountable and responsible for really acquiring the knowledge for appropriate use of these technologies. But your message is clear. Like, we are the ambassadors and we need to go along together um, with trusted partners like the Health AI Partnership, the AMA, and CTRC. So I am really grateful for your time and your insights. And so I thank you. And I'm going to hand it out over to Lydia to close us out.
Thanks so
Thank
much. And thank you, Chris, for an amazing session. I know I personally learned a lot, so I'm sure our many attendees did as well. If anyone on this call would like to connect with CTRC for ongoing support, make sure to check out our website at caltrc.org, where you can find events, webinars, and on-demand resources. Or you can reach out to us directly at caltrc@ocean.org. Another upcoming event is that CTRC is co-hosting our first healthcare AI bootcamp with virtual and hybrid sessions from June through August. Registration will open on June 1st, which you can access through the link in this slide, and you'll be able to access the link in the video recording that will be posted by the end of the month. We also will be sharing the link via the chat. Next slide, please. CTRC also puts out a monthly newsletter, so to stay in the know, we encourage you to subscribe to our monthly newsletter to receive the latest updates on available training, webinars, and on-demand resources. Next slide, please. And finally, before we wrap up, we'd like to invite everyone to complete our short exit survey. We want to ensure that we are meeting your needs, and if you have any feedback or ideas, please feel free to let us know via that survey. I can see responses popping in, so thank you to everyone who is filling out that survey. We do appreciate your feedback, and it helps us plan for future events and make sure we're providing the information that is helpful to you, all the people who turn to CTRC for information and guidance. And with that, I just want to say thank you once again to our keynote speaker, to our moderator, and to all of our attendees. Thank you so much, and we hope to see you at our remaining sessions today.